Let's look at some of the tips in solving NMC licensing questions. So, when a question asks what to do first or what is the most important action that the nurse should take, we look for words like initial, most important, most vital, or even priority. These words help you choose the action that should come before all others, especially in an emergency situation. Even if all the answers are correct, make sure you pick one that is most urgent at that particular moment because they are assessing your level of prioritizing. And so let's look at an example question here. It says that a client is bleeding after surgery. What should the nurse do first? So here we have the first word appearing here. That means that we want you to prioritize needs. What action will you do first? Or what is your most vital or most important action to take? We have A is to check the client's temperature. And then B, apply pressure to the bleeding site. We have C, give pain medication. And then D, notify the family. Let's look at the possible choices here. All from A to D, all are correct. All these choices, or let me say the answers here are correct. But then we want one urgent answer, or let me say urgent action that will save the moment, that will be beneficial to the patient at the moment. So a patient is bleeding after surgery. What will you do initially? What will be your first action? Checking temperature, that is A. It is not the priority here because checking temperature won't help control the bleeding or save the patient from immediate danger. That is loss of blood, right? Even though vital signs is important, checking temperature here is not an urgent action. And also, applying pressure to the bleeding site. We know that this is the most urgent action that should be done in any situation whereby a patient presents to your emergency unit or anywhere. It helps stop the bleeding right away and also prevent the client from going into shock or losing too much blood. And so this is the most initial, or let me say the most important action that the nurse should take first when a patient presents to the emergency department with injury that is leading to bleeding. And also C is give pain medication. Pain medication is important. The patient might be experiencing pain. But what if you give the patient the pain medication and the patient loses a lot of blood and then definitely go into shock? What will you do? So we treat the patient, the cause of the pain that is bleeding before giving the patient the pain medication. And so treating the cause of the pain is more urgent. That is applying pressure to stop the bleeding. And also we have notify the family. That is the last option. This option can be done later when the patient is safe. And so the patient's safety comes first, even before we notify or inform any other person who must know the incident, right? And so the correct answer here is B, apply pressure to the bleeding site.